Yes, pre-manufactured metal-clad, or MC, cables can be used in hospitals, including patient care areas, provided they meet the applicable requirements of the National Electrical Code, or NEC, and any local codes or regulations. NEC Article 515.7b states that MC cables shall be permitted to be used in patient care areas of healthcare facilities if installed in accordance with Article 517. NEC Article 517.13d provides specific requirements for the installation of MC cable in patient care areas, including the following. Firstly, MC cable must be securely fastened to the building structure. Secondly, MC cable must be protected from physical damage. Thirdly, MC cable must not be installed in air handling spaces or other locations where it could be exposed to moisture or corrosive fumes. Yes, MC cable can be used for three-way travelers, provided it is properly sized and installed in accordance with the NEC. NEC Article 300.11 states that conductors shall be permitted to occupy the same raceway cable or enclosure without regard to whether the individual circuits are alternating current or direct current, provided all conductors are insulated for the maximum voltage of any circuit therein. This means that MC cable can be used to carry both the line and neutral conductors of a three-way circuit, as well as the traveler conductors. It is important to note that the size of the MC cable must be sufficient to carry the total ampacity of all of the circuits that will be running through it. NEC Article 310.15b16 provides a table that can be used to determine the minimum size of MC cable for a given ampacity.